Hi, my name is Asha Pervin, working as an infection control nurse at Dr. Mehta's hospital. Now, I am going to talk about VAP prevention care bundles. VAP. VAP is ventilator associated pneumonia. VAP is one of the most common preventable healthcare associated infection in the intensive care units. Also, it impacts upon patients' length of stay, morbidity, mortality, and hospital cost. So, what is VAP? Ventilator associated pneumonia is defined by infection of the pulmonary parenchyma in patients who exposed to invasive mechanical ventilation for at least 48 hours or more than 2 calendar days, and the ventilator was in place on the date of event or the day before. Now let's see pathogenesis of VAP. The pathogenesis of ventilator associated pneumonia is usually requires two important processes to take place. One is bacterial colonization of the aerodigestive tract, and another one is the aspiration of contaminated secretions into the lower airway. Next we will see VAP care bundles one by one. In that, first one is hand hygiene. A clean hand is safe hand. Appropriate hand hygiene with alcohol based hand sanitizer should be used whenever you are handling the ventilator and ventilator circuit. Always follow the steps of hand hygiene and 5 moments of hand hygiene properly. Next, head and elevation. The recommended elevation of bed is 30 to 45 degree unless it is contraindicated, and it may decrease the chance of aspiration of gastric contents and reduce the rate of ventilator associated pneumonia. Then oral care. Daily oral care is very important. Bacteria in the mouth can cause intubated patients to get infection or pneumonia. Establishing regular oral cleansing and disinfection of patients receiving respiratory ventilation reduces the risk of infection. Next, subglottic suctioning. Removing secretions that have accumulated above the endotracheal tube is a significant strategy for VAP prevention. There are many studies found that endotracheal tubes with continuous or intermittent subglottic suction decrease the incidence of VAP in patients who are expected to be mechanically ventilated for longer than 72 hours. Cuff pressure. Maintain endotracheal tube cuff pressure between 25 to 30 mm Hg. If we keep endotracheal cuff pressure less than 20 mm Hg, it will lead to aspiration, dislodgement of endotracheal tube, poor ventilation, and ventilator associated pneumonia. If we keep a cuff pressure greater than 30 mm Hg, it will lead to decreased mucosal blood flow and tracheal stenosis. Stress ulcer prophylaxis. Mechanically ventilated patients are at a high risk of stress ulcer induced GI tract erosions and ulcer with bleeding. So, this group should put on routine stress ulcer prophylaxis is important. Finally, Dvt Prophylaxis. Mechanically ventilated patients are at a high risk of deep vein thrombosis and its complications due to immobility. So, prophylaxis may be mechanical with elastic stockings or anticoagulants can be used. Thank you for watching this video.